everybody. I am on here to go over the next couple sections today, but first I'm going to give you guys just a second if you can go ahead and get your Chromebook turned on if it's not already on. And you can get that same PowerPoint as yesterday pulled up. It's the chapter 1. It's posted under slides. And it's the chapter 1 slides. So if you guys need to pause this video for a second while you get that pulled up, you can. But I am starting where we left off yesterday. So yesterday we covered learning objectives 1, 2, and 3. Just a reminder, when I say a learning objective, it's this red heading. So today we're going to do learning objectives 4, 5, and 6. They are a little bit longer, but learning objective 6 is kind of some simple stuff that most of you probably already know. So I kind of grouped it all together there. So, yeah. I was just at the, what was it called? Lip sync and karaoke thing at the Melba. That was really fun. I probably should have came home and got all this done and not went, but it was fun and I got to see a couple of you guys. So some very good performances. It was very entertaining. Okay, so we are going to jump in on learning objective 4. You can follow along with your textbook and your slides. Hopefully you guys have already kind of read over this. If not, that's okay. You can read it when you get done watching this. Also, just another reminder, the learning objectives directly correlate with the learning objectives in your workbook. So if you're on your workbook pages in chapter 1, you will see that it has the same heading. So if you are working in that section, you should only be looking for the answers in the learning objective 4 of your textbook. They're not going to put the answer to something in learning objective 4 elsewhere in the chapter. Okay? All right, we've already talked about this a little bit, so I'm going to move through it a little bit quickly because it kind of mentions it over and over again, but they really want to stick it in your brain. What does a nursing assistant do? So we've talked about it, or I've talked to you about it. They do vital signs. What does vital signs mean? It's kind of just a term for when we do heart rate, blood pressure, temperature checks. All of those things are a part of vital signs, okay? Baths, helping people go to the bathroom. Range of motion means how we're going to help them move their arms and legs. When you don't use a part of your body, your joints and tendons and everything get kind of stuck in one spot. So if I just kept my hand in a fist all the time, eventually my muscles and tendons and joints would contract and I would not be able to open my hand anymore. So range of motion exercises for our patients are when they can't move those parts of their body, we're going to move them for them so that doesn't happen, okay? Ambulation is another one of your vocab words, and that's just we're going to help them walk. Okay, some people are going to use a walker or a cane or a wheelchair, but however we need to get them from one place to another, we're going to help them do that. Assisting them with their meals. Some people might just need their stuff opened. Other people might need their meals fed to them. So it just depends on what they need. Back rubs, mouth care, making beds, cleaning up areas, and then caring for supplies and equipment. On the next slide, I'm talking about promoting independence is really important. As much as that patient is able to do for themselves, we want them to continue to be able to do that. Okay, so if my patient is Mary and she can sit there and feed herself breakfast, it wouldn't really be in her best interest for me to say, Mary, you look tired. Do you want me to feed you your breakfast this morning? You know, because I want Mary to keep that skill. I want her to keep doing for herself as much as she possibly can because I don't want her to lose that, okay? Now, if they ask you for help, or if there's a certain reason, like Mary's super sick and she's not feeling good, I'm not saying we can't feed her, but I'm just saying we want to promote and encourage our patients to remain as independent as they can, okay? And then here in the slide, I list out what are some things that CNAs cannot do. They cannot put in or remove tubes of any kind. So there's lots of different kinds of tubes that can be put in the body. Sometimes we put a tube in the nose and it runs all the way down the back of their throat to their stomach. We can't mess with those. That would be nursing. A catheter is another example of a tube. That's a tube in the urethra, or where you go pee. So any kinds of tubes, we can monitor them, so we can look at them and we can let the nurse know if there's any issues going on, but we cannot mess with them, okay, or take them in or out. We cannot change sterile dressings. So I don't know if your OSHA 10 went over sterile or not. We will go over it in depth in chapter 4, I believe it is. But when I say something is sterile, that means it has 0 bacteria. Okay, and sterile things come in special packaging that says this is a sterile item, okay? So when we use sterile dressings, it's for people typically when we're worried about them getting an infection. So if, I'm going to pick on Maggie because she's one of the ones I just seen at karaoke. If Maggie skins her knee doing something at FFA, and she comes to me and wants me to put something on it, and I open up a big Band-Aid and put it on there, that is not a sterile dressing. Now, if it was a super deep cut and she had to go to the ER and I was working there, they would probably have me use a sterile dressing. It would come in a very specific packaging and I'd have to open it carefully. I'd have to use special gloves and I'd have to put that on the wound, okay? So sterile means there's 0 bacteria. It's made in a very particular way where they keep all of the microorganisms or bacteria off of everything, okay? CNAs also do not give any medications typically, or perform blood draws. Now, there are situations which CNAs can go and get additional education and they can give medications at the nursing home, but for the purposes of our training and your test and your certification exam, then CNAs do not give medications, okay? The next slide talks about observing and reporting. Wait, I just make sure I didn't miss anything here. So CNAs spend, in most situations, the most time, like face-to-face time, with the patients or the residents, okay? So if they have something that is out of their normal going on, that is something we want to report to the nurse. So if you work at Houston House and you see your patient Mary every single day, and every day Mary knows who you are, she knows where she is, and she's not confused, and then you go to work one day and you walk in and she is very confused or doesn't know you, that is a change from Mary's normal that you would want to go report to the nurse right away, because that can be a sign that something is going on, okay? Now, let's say you are taking care of a patient at Houston House named Gertrude, okay? It's a weird name. I don't know why I came up with that. But Gertrude, let's say she's always confused. You take care of her all the time and she never knows where she is, and that is her normal. That's not something you would need to hurry and go report, because that is Gertrude's normal state for her, okay? So report any changes. If it's not something important, at least you reported it and it's off of your back, okay? Now, there is a link in this slideshow to a YouTube video that I hope Miss Dixon can play for you. but it is just about kind of this really nice CNA. I guess I don't know her in real life. She seems nice. And just her talking about why she does what she does and what makes her a good CNA. Okay. Your book, I'm on page 4, by the way, and I'm still on this same slide. When you guys get done with the video, you can keep watching me. Charting means documenting. So in the patient's chart, we always need to keep in mind their chart is a legal record. Okay, so you hear all the time about healthcare workers, nurses, or doctors getting sued. That is why we document. We document for our patients so that everyone knows what's going on and there's a record of what's going on, but we also document to protect ourselves, and we document all the care we're providing for them, so that way if somebody, years down the line wants to say, well, my grandma got a sore on her bottom because you didn't turn her on her side often enough. They could go back and pull her record, and hopefully my documentation is in there that I turned for every time that I did turn her on her side and that I followed the instructions that the doctor gave me. So we will get into charting or documenting a lot more in depth, but that's just kind of an overview. It's super important to document everything you do that you're supposed to be doing, because you don't want to get charged with neglect or not doing your job. Okay? All residents are the responsibility of every nursing assistant and every nurse. You are assigned specific patients. So, I don't go to work and take care of the entire med-surg floor. There's no way I could do that unless there was not very many patients up there. So I'm assigned a few patients, but that doesn't mean that if a patient on the other hallway needs something that I can't go help them. And I should never say, that's not my patient, you need to go find their nurse. That goes the same way for nursing assistants. So if somebody comes up to you and you're not necessarily assigned that patient, but it's something you can do to help them, and you feel comfortable with that, you just go do it, okay? You should never say, no, they're not assigned to me. You need to go find their CNA, All right. Learning Objective 5 talks about the healthcare team and the chain of command. So the healthcare team is basically everyone that works in healthcare that's taking care of that patient. Everyone has their role and responsibility and what they do in part of taking care of them. Okay, and then there is just different levels of education that they went through in order to get their degree to do what they do. Okay, so I start listing them out here on the slides. It's also right here in your book in Learning Objective 5. It starts with a nursing assistant. So the amount of hours of training for a nursing assistant or a CNA varies a little bit state to state. You're all in luck that Missouri requires more than any other state in the United States. So we're just doing the most here. We love that. So your book says that nursing assistants need at least 75 hours of training. In Missouri, you actually get 175 hours of classroom training and then 100 hours of on-the-job training. Okay? So, yeah, we really do a lot here. Actually, fun fact, I emailed the governor, Mike Parsons. They had a website on the governor's page, and you could email them. And I actually emailed that about how we're the state that requires more hours than anyone, and that it's unnecessary. He didn't change it, but I did try, so there's that. Anyways, for the purposes of your book, nursing assistants need at least 75 hours of training. And they perform basic nursing tasks, everything we've been talking about. I'm not going to go over it again, but that was just a couple slides ago. Then we go to LPNs and RNs. I'm actually going to talk about LPNs first, because if I was just thinking about this as kind of like the rungs of a ladder, you'd have your nursing assistant performing basic nursing tasks, and then kind of one thing above them would be your LPNs. They can give medications and treatments, and they go to about 1 or 2 years of college to get that nursing degree. So yeah, they don't do a lot of education, and the care of that patient is still kind of overseen by a RN. So a registered nurse provides and manages care as prescribed by a doctor. They give medications and everything like that, just like an LPN, but they can kind of do more education, and they make sure all of the treatments are getting done. And typically they're overseeing the work of an LPN, and they usually have their own patients as well. They go to college for 2 to 4 years, just depending on if they just get an associate's degree or if they go on and get a bachelor's degree. Okay. Then we have advanced practice nurses. If you've been to like a walk-in clinic or an urgent care, then a lot of times you're actually seeing a advanced practice nurse instead of a doctor. They can, they are basically a registered nurse that has went on and got a master's degree or a doctorate degree in nursing. The big difference between a regular RN and an advanced practice nurse is that a regular RN cannot make diagnoses, and they cannot prescribe any treatments. I'm an RN, so I know when I go to work, I cannot make a diagnosis and I cannot prescribe anything. I am just going off of the doctor's orders. Okay, so the doctor orders things, or I call the doctor to get orders for things my patient needs, but I can't write any of those. Like, if someone needs a prescription, I can't write them a prescription. That would have to be an advanced practice nurse or a doctor. So that's kind of the big difference. That's why they can work in the walk-in clinic and write orders for you, send you in prescriptions, and do all of those things. They are overseen by a doctor. Okay, and then we move on to a physician or doctor. They obviously diagnose disease, prescribe medication, prescribe treatments. They go to a 4-year school, and then they additionally go on to medical school. So they have about 8 years of education. A physician's assistant is very similar to an advanced practice nurse. The schooling's just a bit different, but all of their job duties are about the same. They also work under the supervision of a doctor. Physical therapist. Somebody in this class wants to be a physical therapist. I can't remember who it was, but I saw their poster. They develop treatment to increase movement, improve circulation, and promote healing. So they really work with like the muscles and the body and help people do exercises to get them back to a level of functioning, or to help pain, things like that. They actually go to school for quite a while. They end up with a doctorate. Now, there is physical therapy assistants who still make really good money. They follow the guidance of the physical therapist and help the patients with these movements, but it is a little bit less schooling. An occupational therapist, they do different exercises to help with certain disabilities, to retrain people in their activities of daily living, and they also teach them how to use assistive devices. They get a master's or a doctorate degree, so again, quite a bit of school. So if somebody has a certain disability, let's say someone's hand is stuck like this, okay? For some reason, your patient couldn't use their hand and it's stuck like this. The occupational therapist can help them use different devices to get them, to help them, sorry, I'm getting sleepy. It's like 10 o'clock at night. Words are failing me. Okay, so our hand is stuck like this. The occupational therapist can help that patient use different adaptive devices to continue to be able to do their own activities of daily living. So one big activity of daily living that everybody does, hopefully, is eat. So if they're going to eat breakfast, their hands stuck like this, and so is this one. I don't know. They can have special silverware that they can, teach them how to use. They can put it in their hand like that, and they can teach them how to use that. Another example would be, let's say someone can't bend over and get things off the floor. They can work with them on how to use a little grabber device and help them learn how to pick up their own stuff or put on their own socks using these devices, okay? A speech-language pathologist basically helps with communication disorders. It can teach exercises to overcome speech problems, and they have a master's degree. A dietitian basically helps with the nutrition aspect for patients, and that will just depend on what the patient needs. We have a whole chapter about different diets and things like that that we'll go over. A medical social worker kind of looks at what does the resident need, and they help find them support services based on whatever they need. So if a resident comes in and let's say they don't have any money or don't have any family and they need some clothes, they will find the financial help for them or the clothing for them and make sure that they're taken care of, okay? An activities director, you guys will actually meet one at Houston House here soon, hopefully. They plan activities for residents to help keep them mentally engaged, help them stay active, help with socialization. Some really popular activities over at Houston House are bingo. I think that's the favorite. They also do exercises with them once a day. They have coloring, they have crafts. They kind of try to talk to the residents and see what they would like and then plan those activities. We actually did an activity, if some of you were in HOSA and probably went, and we made blankets with them. So I coordinated with the activities director and we planned that. So that and the Christmas crafts we did last year. And then the last member of the care team that sometimes we forget they're a part of the care team, but they're probably the most important member, is the resident and their family, or the patient and the patient's family. They can make informed decisions about their care. They can help plan their own care. Yeah, they are super important members of the care team because it should really all revolve around them and what's best for them. And if we don't know what they want, then it's hard to make a plan that's really individualized for them, okay? All right, the chain of command. This is kind of another boring topic, but it is important because it protects you from getting sued. So it is important to go over. So what is the chain of command? It is basically just a line of authority. So it's basically kind of like the rungs of a ladder. Who are you going to report to, and going and kind of following those procedures, not just jumping from here to here. So the whole purpose of the chain of command is that it protects employers and employees from liability. That's important to know. Wink, wink. Okay? What is liability? Liability is basically a legal term for holding someone responsible for someone else. Okay? So if your parents send you to school and you're in my class, I am liable for keeping you safe and teaching you what I'm supposed to teach you. Okay? When we talk about the chain of command, it has this handy little graphic for you in your book, this nice little flow chart on page 7. So I did not put all of that in the slides, but you can flip open to that, and that shows you exactly all those rungs of the ladder. You don't have to memorize this, but just kind of have a general idea and understanding. So nursing assistants are kind of at the bottom there. So if I'm a CNA and I notice something, I need to go report it to the nurse. okay? So that's where it says staff nurses. That nurse can then go report it to the charge nurse. Then the charge nurse can report it to the supervisor, then the MDES coordinator. Then this has an additional coordinator on here that I'm not familiar with. Then the assistant DON, then the DON, and then all the way up to the administrator, okay? Sometimes if you're at work and let's say the nursing supervisor isn't there that day, they might then go up to the next person. But as long as you're trying to report things in the proper manner, then you're doing good. Let's say I'm a CNA and I go report something to my RN or LPN and they kind of blow me off and don't take me seriously and it's something important. I can then, since I did try to report it to them, then I can go on to the charge nurse and the supervisor and on up from there, okay? Scope of practice, that's another vocab word, and it basically means what you can do in your job. Okay, so the scope of practice for the CNAs is what we're going to focus on, and that's that list of things that we do and the things that we can't do. So when it says making sure you're working in your scope of practice, that just means don't do anything that's not what's defined in your job, okay? All right, care plan. This is something we kind of talk about all year, but this is an individualized plan for each resident or each patient. So when I go to work, that's the first thing I look at. They tell me, you know, you have 208, 209, and 210. Okay, so those would be like my room numbers. I instantly go add those patients to my list, and sometimes before I even go see them, I look at why are they here? What medications do they need? What do I need to do to take care of them? And all of that information is found in their care plan. So every patient's care plan should be different because it's based on exactly what that person needs. So it lists any services they need, any treatments that they need, how often those things need to be done, what they're there for, what they're diagnosed with, any monitoring we need to do, any equipment they need. You know, does this patient need to walk with a walker? Do they need a cane? Do they need to wear oxygen? Any nutrition requirements? Do they need, you know, supplemental shakes 3 times a day? Do they need to be on a diabetic diet? Do they need help with eating? And then these care plans change depending on, you know, observations from you as a CNA, observations from the nurse, and any changes in their condition, okay? So these care plans change constantly because our patients don't just stay the same all the time, right? And then let's see, on Learning Objective 6, we're just going to briefly go over this one. It talks about policies and procedures and kind of what are, those two things kind of go hand in hand to me. A policy is a course of action that should be taken every time a certain situation occurs. So just an example, my syllabus listed out policies and procedures for our classroom. So if I have a policy that we have no food or drink in the sim lab and I see you with food or drink in the sim lab, you know, my policy for that would be to take it out of the sim lab and to let you know not to do that and maybe issue a warning. A procedure is just a method or way of doing something. Then just kind of highlight a couple things here. We do continue to talk about these later in the chapter, but we shouldn't be discussing any personal problems with our patients or their family members. All patient information has to be kept confidential. We shouldn't be doing anything that's not listed in the care plan. We can't just kind of make up our own thing. We cannot accept any gifts or money from patients or their families. That's actually against the law, so we can't do that. And then we need to be on time for work and dependable. that's the last slide I made for this learning objective, but it does go on to talk about, professionalism. I didn't make slides for all that because I feel like you guys have probably went over that before, but do make sure you read this section of the book because there are still test questions on it. We should always explain what we're doing before we do it. So if I go in my patient's room, I should knock, I should call them by their preferred name, and then I should tell them what I'm doing there. If I'm going to do their vital signs, I don't just, start putting their blood pressure cuff on. I need to say, "Hi, Mrs. Smith. I'm Jennifer. I'm going to be your CNA today. Would it be okay if I got your vital signs?" And then they can say yes or no. A professional relationship with an employer includes documenting and reporting carefully and correctly. That would be something good to know for your test. And then it talks about being compassionate, showing empathy, being tactful, and respectful. Those are all kind of self-explanatory things. Just read over them in your book. Unprejudiced. Just keep in mind, we work with people from many different kinds of backgrounds. We should give everyone the same quality of care regardless of how old they are, what their gender is, their sexual orientation, their gender identity, religion, race, ethnicity, or condition. So we need to, give everyone the same outstanding care no matter what. All right, that is all for today. I hope you guys have a great day, and I will probably see you tomorrow. Bye.